Hi, I'm Dr. Bardia Anvar from Skilled Wound Care. Today I wanted to talk a little bit about diabetes and foot wounds or foot ulcers that may develop in this population of patients. Unfortunately for diabetic patients, they are highly at risk for developing diabetic foot wounds. And it is now recommended that physicians or nurses examine patients who have diabetes in both feet as often as possible, but at least once a year. In addition, family members and patients should be educated on properly fitted shoes that do not cause undue stress to the feet, as well as examining the feet for the development of any calluses or ulcers that may be developing. Unfortunately, if a patient does develop a diabetic foot ulcer, it is challenging to heal these patients. And one of the most important things in patients with diabetes is to get tight glucose or blood sugar control to prevent the development of these wounds and also to manage these wounds. Now, when patients actually develop these wounds, one thing we like to recommend is a total contact cast for the feet or a total contact boot where you have hexagonal cutouts or the actual area of the ulcer, especially if it's a plantar ulcer, meaning it's on the bottom of the foot, is relieved of any pressure so that the ulcer does not worsen or deepen. That is very, very important. Next, for physicians examining these patients, we recommend, or this is actually by a panel from the Vascular Surgery Society, is to actually probe patients' feet to see if there is any bony involvement, or also performing a possible MRI to rule out osteomyelitis, and then treatment of an infection of the bone will be needed in adjunct to actual treatment of the wounds itself. We also recommend the same thing that our practice does on a weekly basis is debridement of the entire callus surrounding the actual wound itself, as well as any of the devitalized tissue in the wound bed of a diabetic foot ulcer. This is very, very important, and we provide surgical debridements at the bedside in our practice. Foot ulcers that usually are not improving, that are especially in diabetic patients, adjunctive modalities are available as well, and they must be looked at in terms of using negative pressure wound therapy or using amniotic membrane substances or other things that can help improve and speed up the process. My name is Dr. Bardia Anvar, MD from Skilled Wound Care. Please make sure to like our video and subscribe to our YouTube channel for other updates about wound care. And we look forward to seeing you in any one of our wound certification courses or our educational wound posiums. Thank you.